Congress went home for a few weeks and the president's left the White House, but that doesn't mean the news went on vacation. What's going on? This is Healthcare Triage News. When we last left you, the Affordable Care Act lived to see another day as the Senate failed to pass any type of repeal and replace bill. The president was not happy and continues to be not happy. Many Republicans are also not happy. You can't always get what you want. But that doesn't mean there's nothing the White House can do. There are a number of ways in which the president and/or Health and Human Services could hurt the Affordable Care Act. The most visible are the cost-sharing subsidies. These are payments made to private insurance companies on the exchanges to reduce deductibles and out-of-pocket payments for poorer people. Remember that the subsidies or tax credits that people on the exchanges who make less than 400% of the poverty line receive are to help with premiums. But there are still high deductibles on many of those plans and people wouldn't be able to afford them. And so the ACA also helps defray those. But because of the complexities of the law, it may, and I mean may, be in the president's power to refuse to pay them. If he did so, it would hurt insurance companies because they get the money. They'd also have to raise premiums on everyone else, which would be bad for people on the exchanges, drive even more healthy people out of the market, which will again be bad for the people on the exchanges, drive even more healthy people out of the market, and you can see where I'm going here. President Trump has repeatedly threatened to withhold those payments. He's also made them into a month-to-month game, so insurers don't know if they're getting the money that was promised to them. It's likely contributed to some exiting the market. Another way the administration could sabotage the ACA would be to undermine the individual mandate. Remember, that's one of the ways that we try and get healthy people into the market. It helps lower premiums overall. They could tell the IRS not to go out and enforce it. President Trump could stop paying subsidies that members of Congress and their staff get to buy exchange plans. That would be just mean, but he could do it. But Congress may have had enough with all of this. Before they took off, a group of about 40 House Democrats and Republicans, calling themselves the Problem Solvers Caucus, said they're gonna tackle this in a bipartisan manner. The first thing they want to do is pay the cost-sharing subsidies. If they voted to make this happen, it would take that stick out of the president's hands and reassure the market. They also want to weaken the employer penalty to affect companies with more than 500 workers instead of 50 workers. This would likely push some more people onto the exchanges, but fine. They also proposed a federal stability fund, a pot of money that states could use to help reduce premiums or pay for outliers, people who cost a lot of money each year. Those funds were in the repeal and replace packages, and they're popular with states. They also want to push more state-level innovation. And of course, they want to get rid of the medical device tax. Now, whether ideas like this ever get a vote is another matter. They also need to pass the Senate and get signed by the president. But it's a signal that some Republicans may be tiring of the repeal and replace dance, are worried about how a wounded exchange market may hurt them politically, and may want to stabilize things and move on. Time will tell. So will Healthcare Triage News. Healthcare Triage is funded in part by viewers like you through Patreon, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank Joe Sevitz and Sam. Thanks, Joe. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.